This is Dr. Drew Hall with Upper Cervical Healthcare of Los Angeles and Carson. Today I want to talk about one of probably the most common things, health conditions, symptoms that people out there in the public generally suffer from, and that's neck and back spasms. So what's a spasm? A spasm is when a muscle goes in contraction and it stays that way. And for those of you, which is most of you out there in the public who have gone through this, you know it doesn't feel good. So generally most neck pain, most low back, most mid-back pain is coming from a muscle that is chronically tight and it's not loosening because it's getting a bad neurological input. So of course there are varying reasons why people suffer from neck and low back pain, but one of the major reasons people have neck spasms and back spasms is because there is a joint, or sometimes multiple joints, in the spine, most usually the upper neck, and we'll talk about how that affects the low back in a second. But when we'll back up, every joint in your body, where they meet together, there's a fibrous ligament that basically gives it integrity and strength. If you didn't have what they call a joint capsule, you could take your finger and just turn it at 90 degrees because there would be no stability in the joint. When someone is in a car accident, when someone gets dropped upside down on their head wrestling onto the ground, when someone gets slammed into the wall playing hockey, when someone dives off their surfboard and they think it's 10 feet deep and it's 2 feet deep, those types of injuries can cause neck joints to misalign during impact, tear that fibrous joint or fibrous ligament that gives the joint support, and that joint can misalign, the ligament tears, and then what happens is because you've lost the integrity of the joint doesn't move the way that it's supposed to. And so a couple of things happen. Your body has a protective mechanism, and so what does it do? It tightens the deep layer of muscles to give the support to the joint that doesn't exist there because the ligament's damaged. And then there's this whole chain reaction that goes on, an adaptive mechanism through the rest of the spine when this upper neck area is damaged. And so you have an initial neck injury, it damages the soft tissue, the vertebra misaligns, the deep muscles go into spasm, and then the rest of the spine kind of compensates for this. So there's a difference between someone who has a muscle spasm for a day or two, and then it kind of works its way out. That's great because the body was able to do that, but there's other people who are suffering with chronic neck spasm, with chronic low back spasms, chronic mid-back tightness, and the majority of these cases it has its roots in spinal joint injury. So what can you do? Most of you who may be listening to this have tried massage and you found that a day or two goes by and the pain and the tightness just comes back. Some people take over-the-counter medication. Other people try stretching, and all those things absolutely have health value. But as I tell patients who come in with chronic headaches and chronic neck pain and chronic back pain, I tell them you can have the best diet in the world, you can have the best medical doctor, you can meditate an hour a day, you can sleep a full 9 hours. But if you have a joint in the upper cervical spine and is locked out of its normal range of motion from a prior injury, none of those things are going to fix that. So in our Los Angeles-based offices, we have 3 different doctors. We're experts at determining whether you had a prior neck injury and finding out exactly which bone or bones it is. And then once we find out which bone it is, or bones, we take very precise imaging of the upper neck to look at how the joints fit. So we look at each individual joint to find out which one has misaligned, how much is it misaligned, what's the angulation of that joint. And then the goal of the procedure is to introduce a very precise force with no twisting, popping, or pulling to get that segment back under the body's control, to get the joint back in motion. And what inevitably happens over time of keeping it in motion, the joint capsule will start to heal, mend, and repair. And the structural adaptation, all the muscle tightness that's adapted to that upper neck problem, the body will slowly start to right itself and you get more symmetry in muscle tone. So we just talked about muscle spasms in the neck, back, low back, mid back. That's just kind of the tip of the iceberg. And I always actually tell patients who come in with these sorts of problems when they resolve, I'm glad that it happened to you, because the bigger issue is what is that spine that's misaligned doing to not just the neck and the muscle spasm, but what's it doing to the internal function of the body. Basically, every single cell in your body is controlled by nerve messages that passes down through the C1 through the cord. And if that top vertebra is locked and you have neural irritation in there, it's causing your body not to work as well as it should. So beyond helping people with their pain problems, getting this corrected is one of the very many pillars that you should be incorporating into a health program to maximize your longevity and your health. So if you come across this video and you have neck pain, you have back pain, or any other chronic health problem that you're dealing with and this makes sense, we do offer a free consultation in both of our offices. Our Los Angeles based office's phone number is 213-399-7772. And our Carson office number is 310-324-6172. If you're outside the Los Angeles area and this has made sense to you and piqued your interest to the point where you're interested in seeing an upper cervical doc, you can call either one of those numbers and we'd be happy to find you an upper cervical doctor in your location that can help. So hope for the information in this video was helpful, educational, and hope to see some of you soon. Thank you for listening.